Hello, this is a video lecture for ethics and legal issues in the veterinary office procedures course. So I guess the first question we want to ask ourselves is, what are ethics and why are ethics important? So why are ethics important? Ethics are important because they hold each member of an organization to a higher standard, and they help those people to see, to determine right from wrong. So basically, ethics kind of helps us to guide some of our decision making, and helps us as a whole profession, veterinary medicine profession, to hold that higher standard and just do best by our patients and by our clients. So what are ethics? We talk about three different areas of ethics. So first of all, there's social ethics. So social ethics are the principles adopted by or accepted by society at large, and social ethics tend to be reflected in the laws. It's social in terms of like our entire society pretty much agrees, right, that murder is wrong. So we have a law against murder. We agree that it is inappropriate or wrong to abuse animals, so we have laws as such. The next area of ethics that we talk about is personal ethics. Our personal ethics are going to be different between individuals, and it shows us what's right and wrong. So our personal ethics are kind of developed by a lot of different things. So like our family background, so what our parents taught us is right and wrong, our cultural backgrounds, right? Different cultures value different things. And then like if we have a religious background, that as well, right? So right and wrong is going to look kind of different to some people based on, those backgrounds that they have. And then lastly, which is the area we're most concerned about, is professional ethics. So the professional ethics are developed by the professionals of a particular discipline. So in our case, we're talking about the professionals within veterinary medicine. And it includes rules, codes, and conduct for professionals to follow. So professional ethics is what we're concerned about and what we're talking about most here. In general, though, when we're talking ethics, we're talking what is right and what is wrong. Sometimes ethical questions can be a little bit tricky. I did give you, as an exercise today, a discussion question that gives you a scenario and asks you what you would do. And there is no right or wrong answer to that scenario. So all of you are going to have a bit of a different background coming into that question, and you might have different opinions on how to handle it. So I'll be interested to see and to read your guys' different takes on that scenario. Okay, so our profession has a code of ethics. So this one here, this code of ethics is from the North American Veterinary Technology Association, or NAVTA. It is in your textbook on page 77, box 4-2. And this code of ethics is for like veterinary assistants and veterinary technologists. It looks very similar to the code of ethics for veterinarians. I did link that in our Brightspace today. So the CVMA, the Canadian Veterinary Medical Association, has a large document about professional ethics in veterinary medicine. So I linked that for you to have a look at what the doctor's kind of code of ethics is. It's very similar to ours though, and then it expands upon each point. So I thought it's a really good, solid read. It's maybe a little bit bigger than you want to get into, but I think it is a good read and worth the time. So let's look at our code of ethics. So this is what VOAs and RVTs should abide by in terms of our code of ethics. And the code of ethics, honestly, is something that I take really seriously, and you should take seriously if you are in the profession. So our first code of ethics, our first rule or our code is to aid society and animals through providing excellent care and service. This is one that can sometimes, believe it or not, be challenging. I'm sure you're like, really? How and why? Didn't we all get into this business because we love animals and we want to help them? I'm pretty sure all of you wrote that you wanted to join this program because you want to help animals. And that's a beautiful and a noble cause. Sometimes though, like that's not the hard part. The hard part is providing excellent care and service. Sometimes you're just tired, or your heart's not in it, or it's been a really long day, or you don't want to have to deal with this obnoxious client for the 15th time today. And that's where it gets hard to provide that excellent care. But it is our job, it's our professional code of ethics to continue to provide that excellent care. We want to prevent and relieve suffering, and certainly that is doable within our profession. We can help those animals. We want to promote public health, and part of that is controlling zoonotic disease and informing the public. So that is something that we will certainly talk about when we're talking a little further down about malpractice. But failing to inform an owner about a zoonotic disease and that owner contracts the zoonotic disease, we have broken our code of ethics. It's really important that we are protecting public health by informing those that need to know. We need to assume accountability for individual actions and judgments. That means that whatever decision or choice or behavior you choose to engage in, you need to own that behavior. So if you make a mistake in practice, you need to be accountable to that mistake immediately. You need to say, I think I made a mistake, and bring that to your superior's attention. In our business, some mistakes can be life or death. But if we catch those mistakes sooner than later, we can prevent it getting to the death point, okay? So there's lots of mistakes that might be made that can be fixable. So it's really important to make sure that if you recognize that you've made a mistake, to own that mistake immediately and bring it to someone's attention. We, as part of our code of ethics, protect confidential information. So that's part of our code of ethics. It's also part of the law. So clients and patients are entitled to confidentiality. I posted a video in the Bright Space discussing confidentiality and clients. It is something that's really important as part of our code of ethics. And like I said already, it is the law. So by breaching that confidentiality, you can be potentially breaking the law as well. So you'll notice if I do tell stories that are about clients that I've seen or patients that I've seen, I don't ever use their names. I never really give you any identifying information so that I'm not breaching that confidentiality. And then we want to safeguard the public and the profession against individuals deficient in professional ethics or competencies. So what does that mean? I feel like there's a lot of big words in this sentence, but what does it mean? So to say that we're safeguarding the public and we're safeguarding the profession against individuals that are deficient in professional ethics or competencies, that means people that shouldn't be practicing veterinary medicine because they are their knowledge is inadequate. So that means they don't know what they're doing, or if they're not practicing in a professional and ethical manner. So if you are aware of a veterinarian, let's say, that is, I don't know, like running unnecessary tests, or I don't know, like way overcharging for procedures, or charging for procedures they didn't do, or something like that, that would be someone who's deficient in professional ethics. If you know that your veterinarian is doing a surgery that they have not received proper training in, and should be handled by like a board certified surgeon, that's maybe a deficient in competencies, right? They don't really know what they're doing. You'll see if you have a look at those professional ethics for veterinarians, veterinarians are ethically obliged to consult if something that they don't know or if something that they're trying to do is beyond their knowledge. So they are obliged to do that, okay? And we want to safeguard the public because we don't want anyone being harmed by either unethical veterinarians or incompetent veterinarians. We don't want anyone being harmed. And not only are we protecting the public then by reporting those types of people, we're also protecting our profession. You know how there's like kind of jokes, right, about like lawyers and, you know, or like used car salesmen where they kind of have like a bad rap, right? And we don't want that to become the veterinarian, right? We don't want people to think, well, we can't trust our veterinarians because all they're trying to do is take our money, or none of them know what they're doing. We don't want that in our profession. We want the public to be able to trust us so that they continue to come and see us. We want to ensure that conditions of employment are consistent with excellent care. That means that we're doing everything we can to do the best thing by our animals, and that we're not working in either an unsafe way or with, inadequate equipment, things like that. So we want to make sure that the work we're doing is consistent with the excellent care. We want to remain competent through lifelong learning. So as a vet tech, I am obliged to gain 15 continuing education hours every single year. So I'll go to conferences, I'll go to seminars, I'll do online learning to continue to be up to date in the profession. And the same thing applies to veterinarians as well. They have to do, I believe it's also 15 per year. And that is really important to stay up to date. So medicine has new changes and new technology all the time. So much stuff that I learned in school just doesn't apply anymore because there's new and better information out there. So that's a good thing that we can improve and we can learn and do better. So VOAs don't have to be registered, and they don't have an association that they're a part of that enforces lifelong learning, but I really encourage you to embrace it. I think you guys are all here because you love animals and you're excited, hopefully, about this profession, and I hope you continue to be excited. So anytime you have an opportunity to attend some kind of continuing education event, do it. Take that opportunity. Drug companies and food companies will often host seminars to teach you more about their products or the diseases that their products treat. Take advantage of those. For one thing, you get a free meal, which is great. You usually get some swag stuff too, so at least a new pen. And then also you get that new knowledge. And that just pays so many dividends forward to your clients that you're seeing. You can take better care of your patients. You'll have a better understanding of what you're talking about. It's just win-win. And I find for me personally, when I do attend continuing education events, I feel really like motivated and inspired to do better. So hopefully you'll find that as well. And then lastly, we want to collaborate with members of the veterinary profession to ensure high quality care. So that means that if we're not sure how to do something, we ask. Okay, so that applies within our own clinics. So if you're not sure how to do the best job of disinfecting a kennel, you ask someone, hey, how can I do the best job of disinfecting this kennel? And it goes right up to the top. So if the veterinarian isn't sure about how to treat a case, they consult with someone to find out. Okay, so that's the NAVTA Code of Ethics. So that is covered in your textbook. You can have a read through it in there. But those are the things that we should be really like internalizing and taking to heart. That these are part of our role now within the vet hospital, is to make sure that we're doing all these things every time that we show up for work, okay? Okay, so we talked a little bit about the MVMA. The MVMA is the Manitoba Veterinary Medical Association. So I'm going to apologize right now because these notes are kind of messy because I kind of typed them up wrong and realized after, so I added some stuff in just in pen. But what is the MVMA? The MVMA is a regulatory and professional organization for the vet profession in Manitoba. So the MVMA, if you recall, I said registers doctors and technologists. They ensure that we're keeping up to date by doing that continuing education, etc. So let's talk about the roles then of the MVMA. So the number one role is that vets in Manitoba are governed by provincial law as well as bylaws established by the MVMA. So roles here, number one would be like make and uphold vet laws, if you want to make it a little bit easier to remember. So the MVMA establishes bylaws. They establish who can do what in the vet clinic. So they remember earlier I was talking about veterinarians, how only a veterinarian can do those four things, right? Diagnose, prognose, make a treatment plan, and and do surgery, right? So those are 4 things that only veterinarians can do. It's the MVMA that has determined that, okay? So the MVMA makes bylaws about what clinics have to have in them. They make bylaws about who can do what. They make bylaws about what kind of drugs can be used in the clinics, etc. So there's so many different bylaws. I do have a document that I attach. I think it's just called Manitoba Veterinarian Laws. And the MVMA bylaws, there's a link to them right here. And right at the top is Manitoba Law, the Veterinary Medical Act. So you can have a look at those. There are a lot of like legalese and jargon, but I think it is a good idea to know what laws you have to be practicing under, right? Because working in a vet clinic, these laws are really applicable to you. So I do encourage you to click through both those links and have at least kind of read through, right? Like at least skim it. Anyways, moving on. Number 2 role is to regulate the practice of vet medicine in Manitoba and ensure that Manitobans have access to qualified vet care. So that means that they are registering doctors and techs. So they're making sure that whoever is working in vet medicine has the proper credentials to be able to work. And that ensures then that Manitobans have access to qualified vet care. By making sure that the people that are registered are qualified, they're making sure that veterinary medicine is qualified in Manitoba, okay? And lastly, they advocate for animal health, they grow public awareness of vet medicine, and they keep members informed and connected. So by advocating for animal health, that means that they usually have like position statements on hot topic things. So for instance, cat declawing, they used to have a position statement on it saying that they really discourage doing it. But recently, all the doctors, the DVMs and the MVMA were able to vote on whether or not they should ban declaw procedures. And the veterinarians did vote to ban elective declaws in cats. So that's excellent. So then that becomes a bylaw established by the MVMA, right? And then they they grow public awareness of vet medicine. So for that, they'll often do like ad campaigns. You'll see like Animal Health Week is usually advertised. I think in October, I think it is. I can't remember. I should be better at this. There'll be like an MVMA booth present at like animal events. So they have like the Pet Expo and stuff like that every year. And also they'll always be available for comment to like news outlets when there's animal stories in the news. So generally there's always going to be some kind of comment from the MVMA on those things. And then lastly, keeping members informed and connected. So I get probably 3 maybe emails per week that are, they call it the Post. And it's basically a little news bulletin about what's news in Manitoba in terms of veterinary medicine. So that's all a really good thing. You can use the MVMA as like a networking event, whatever. They put on continuing education events, etc. So basically, the MVMA is really important to our profession, and they do have a really heavy hand in terms of the laws that we follow. Okay, so let's talk about malpractice. So malpractice definitely is a legal issue, right? We certainly do not want to be accused of malpractice, and we will talk about ways to avoid that. But let's first talk about some examples of malpractice. So I think in your notes I included a definition of malpractice, and I can't remember word for word what it is off my head, but basically malpractice is when you're like some kind of error or gross negligence that endangers the animal, right? So some examples. Incorrect drug administration. So giving the wrong drug to a patient would be an act of malpractice. Giving an incorrect strength of drug administration. I actually attended a CE, continuing education event today about drug errors. And in one of them, they were saying that they gave a cat ketamine it was supposed to get, I think 5 milligrams, but the tech that calculated the dose calculated it wrong and gave like 500 milligrams or something, and the cat basically immediately went into cardiac arrest. So certainly some of these acts of malpractice can be really like life or death. And some of them are just like, you know, an animal's probably not going to die because they're messy, but it is considered an act of malpractice, and honestly I think cruelty. But failure to clean animals that have soiled themselves. So if you see, you know, pee or poop or vomit in the cage with an animal, you just go ahead and clean it. We do not want to leave animals in their own mess. For one thing, it's cruel. I mean, do you really want to like study like in your bathroom where the toilet doesn't work, right? Like you don't want to be around that waste. And then also it can actually harm the animal. So urine scald and fecal scalding is a thing. It really harms their skin to have any of that material on them. Abandonment. So if a veterinarian is supposed to be taking care of an animal and does not, that's abandonment. Leaving a foreign object in a patient after surgery, I think that's pretty obvious as an example of malpractice. Failure to exercise good judgment. So that's a little bit of an open-ended statement, I think. But basically the kind of judge of good judgment is, would other peers in this professional group make the same call, okay? A failure to communicate. So again, that kind of sounds like abandonment a little bit. Not being able to get a hold of that doctor can count as malpractice. Loss or damage to the patient's personal property. We kind of touched a little bit on this when we were talking about the different roles in the vet hospital, but I said how important it is to label all the patient's belongings, and that's because of this. If anything is lost or damaged in the hospital, that can be considered an act of malpractice as well. Disease transmission. So if an animal gets sick from being in our hospital, that can count as an act of malpractice. So if we have an animal with an infectious illness, we want to keep them in quarantine so they're not making the other animals sick. A patient attacking another while in the vet practice. So if you have a patient that's known to be aggressive, they should not be in the waiting room. We do not want animals to be able to interact with each other at the vet clinic ever. And this is a big part of why. Or using defective equipment or medications. So expired drugs, that is an act of malpractice. Using, you know, let's say an anesthetic machine that hasn't been calibrated properly would be an act of malpractice, because there's potential there for really doing damage to an animal. So how can we avoid malpractice lawsuits then? That's a great question. For one thing, we want to make sure that our medical records are really complete with every single detail. Every single detail. The medical record, and again, I was saying, I just did this continuing education event today on medical errors. Even if there's an error, it needs to be documented properly in the file. We don't want to try to cover any of that up. We want to document everything that happened so it's really complete, and then we have nothing to hide, right? And I think that is a good thing to do. So we want to, you know, tap into our ethics there and make sure that we are being accountable and making sure that our records are complete. Every treatment and every treatment recommendation must be clearly documented, along with any refusals. And I have refusals underlined here. So we need to have, we talk about consent in a little bit, but we need to have consent from the owner to be able to go ahead with any treatments. But if they refuse to do a treatment, we need to document that. Offered to, I don't know, whatever, offered to trim nails, owner declined, okay? And then when the owner comes back later and is like, this nail's growing into the pad of my cat's foot, how come you didn't do anything about it? Well, you refused, right? So we have that documented there. So talking about consent, clients must be informed when they're making decisions, and we must have proof of informed consent. So typically we're going to have consent forms. I have some to go over and show you here. We need to go over and get that consent with every single client before going ahead with a procedure. When we have that signed form in the file, there's no question of, well, I didn't tell you that you could extract that tooth. Yes, you did. It's signed right here on the form. And if a patient needs a higher level of care, the vet must advise referral of the case, okay? So then you don't have any like gross negligence claims against you. So this happens quite often where you get a patient in at the vet clinic and it is maybe in shock or something, and we need to stabilize the animal. We will get them stabilized. This is an emergency situation. We're going to stabilize the animal as soon as we can in our vet clinic. Once that animal is stable though, our vet clinic is not the place for that animal to be. If it needs to be watched 24 hours a day, my clinic that closes at 7 o'clock at night isn't a good choice. So we need to transfer them to like one of the 24-hour facilities. Okay, so let's talk about informed consent. Hopefully you guys already have an understanding of what consent is, but consent is basically like giving permission for something. But we don't want just consent in the vet clinic. We don't want the owner to say, yes, sure, do whatever you want, because that doesn't really count as informed consent. We want the owner to know all the risks of a procedure and all the benefits and be able to make a decision based on those things. So our formal definition: informed consent is when a vet practice has given information to a client regarding the proposed treatment, allowing the client to make an informed decision regarding whether to proceed with the treatment. So, informed consent ensures that the client has a complete understanding of the procedure. That includes all the risks, all the benefits, and alternative procedures. An alternative procedure can also just be doing nothing, right? It's not inappropriate for a client to ask the question, well, what if we didn't do any of this? What would the potential outcome be for my animal? Okay. One thing that I'm going to discuss with you guys right now, and I'll probably discuss it again, honestly, when we talk about estimates. But one thing that lots of owners don't realize is that they have the right to say no to what the doctor's advising. But at the same time, they should be asking, well, what are my other choices? So doctors are always going to suggest like the Cadillac of treatment plans, okay? Because they can only assume that if you brought your animal to the vet, you want to do the absolute best thing for your animal. But sometimes that best thing is just not affordable and not doable for the owners. So in which case, they need to say, hey, like, do you have a Toyota maybe available? I can't afford this Cadillac. And then the doctor can say, okay, well, sure. Well, we could do these 5 things that would help to stabilize the animal, get him in a good place, and maybe these we could put off for later and see how the animal's doing. Okay, that's reasonable. Or if even that's not doable, they can ask the question, and what if we decided not to treat? Or what if we didn't do these tests? What would we do with that? And how would the animal do? So it's okay for them to ask those questions. And that's part of informed consent, right? Is knowing the whole picture. What happens if I treat my animal? What are the risks? What happens if I don't treat my animal? And what are the risks? So we want our owners to really understand all the procedures that are going ahead. So I have some consent forms here to show you. I have some examples. Okay, so here's an example one. So usually we would have this pre-filled out for the patient going into the room with the client to go over this. So we'd have the patient's name, the owner's name, and the date, and then we'd be describing whatever procedure is happening here, okay? So let's say this animal's just in for like a routine spay procedure. So we'd put spay. Are they doing blood work? Are they doing IV catheter? Oh, in this case, we have microchip in there. Do we want microchip, etc.? And we're going to put everything on here that we're going to do for that animal. Nail trim, yeah, that's on there, right? Everything that we're going to do. So medical history, they can make any notes here if there's any medications, if they have any medical conditions, if the animal is pregnant, any other information they want to share. Is the dog currently on heartworm preventatives or immunizations? So yes or no, we can say. Are cats current on immunizations? Yes or no, okay? And then they have a note here about heartworm prevention, that they might need to be tested prior to anesthesia. So surgical options. So they kind of, in here, they talk to you about the risks, right? And then they have an accept and decline here. So IV catheter setup, we always want to explain to the owners why IV catheters are so important. So I'm going to go ahead and tell you right now why IV catheters are so important. So when we have an animal that's having surgery, IV fluids are really important to keep that animal at its safest during anesthetic. So IV fluids do a few things during surgery. Number one, they keep blood pressure up. That's really important. Sometimes after sedatives and anesthetic drugs, the blood pressure drops fairly low. So that is not necessarily as safe as it can be for the animal. As well, it helps to replace any blood loss during surgery by replacing it with extra fluids. And it helps to flush out those anesthetic drugs we use. So the faster, remember, oh wait, did we not talk about this? I don't think we talked about this in A&P, but anyway, the liver and the kidneys are the organs that process drugs and get rid of the waste drug, right? So that all needs to get out of the system as soon as possible. IV fluids helps to speed that along. And then also, if there is an anesthetic emergency and we have an IV catheter already placed, it's really easy to give emergency drugs super quickly. If we have an emergency situation and there is not an IV placed, we're going to need to have to place an IV first before we can deliver those drugs. And sometimes that's really tricky to do in an emergency situation because blood pressure drops really low in an emergency. So it's difficult to get an IV catheter if the blood pressure is low. So I 100% recommend IV fluids to every single patient that has surgery. And I mean it. It's not just a money grab or a plus extra procedure that they don't really need. I think it's absolutely important. So in this case, after you've given that information to the owner, you'll ask the owner, do you accept going ahead with the IV catheter or would you like to decline it? So now they understand the risk if they decline and there's an emergency situation and we can't revive that animal, they understand that they're taking that risk, okay? Well, and then this has the option of microchip, so you can accept or decline microchips. And then, I guess in this clinic, blood work is mandatory to have done. So they have in here that they have to have it. But if you have an option of blood work, like if blood work is a choice where you work, again, I always really strongly encourage it. So pre-anesthetic blood work is really important because it checks a couple different things. First, it's going to check the level of red blood cells, which I'm sure you guys remember from anatomy and physiology. Red blood cells are responsible for carrying oxygen throughout the body, which is very important. We also don't want to, if we see an anemia, we don't want to do a surgery and have the potential of losing more blood, right? Also, it's going to check for the amount of platelets, which are responsible for clotting. I'm sure you understand that when you're cutting open an animal and it's going to be bleeding, we want that animal to be able to clot blood. So we're going to check those two things. We're also going to check the function of, I missed one thing too. We're also going to look for white blood cells. If there's a really high number of white blood cells, that can indicate an underlying infection. We probably don't want to do surgery on an animal that has some kind of infection going on, so we might need to delay surgery. We're also going to check the function of the liver and the kidneys with that blood work. So the liver and the kidneys, as I said already, are responsible for filtering out the drugs, the anesthetic drugs we use. So if they have a problem with the liver and the kidneys and we don't know about it yet, which is certainly possible, again, if you remember from A&P, they don't show signs of being ill until the liver or the kidney is damaged by 75%. So the animal could have very little amount of function left in those organs and still not be showing signs. So if we do blood work, we can see if there's liver or kidney problems before the animal shows us that there's kidney or liver problems. That way, we can either adjust the anesthetic protocol to be safer for that animal or delay the procedure until the animal's in better condition. So I think blood work is absolutely super important. Again, though, if they're in a situation where they can decline or accept, if they choose to decline, I've told them the benefits of doing that, and now they know the risk that if they don't do blood work, they're risking that the animal has a liver condition and doesn't recover as well from anesthetic or has some kind of adverse event. So the last part here is I'm aware of the risks and understand the information presented in the surgery form. I give the clinic permission to proceed with the surgery, and if the need arises, to perform life-saving procedures, and that I'm liable for the extra cost involved should my pet require this. So then I'd have the client sign it. I'm going to witness it. And then I always want to get a phone number that they can actually be reached at today. I don't want to just assume whatever number is in their file is going to be accurate. Because like, I don't know, I have a house phone, but if I'm at work, you're not going to be able to reach me at my house phone. And if I'm at work while my pet's in surgery today, I need you to be able to reach me there, okay? So that's one example of a surgical consent form. Here's another example. Very similar again. This one has the option to do blood work. So I understand there may be an increased risk during anesthesia. That's written under the decline section. Again, same here. I understand there may be an increased risk, right? This might, oh no, it's not two-sided. This one is not a complete sign, or form it looks like, because there's no thing for them to sign at the bottom. Here's another example. So in this one, they're initialing that they approve, and I would honestly have them write decline and initial that on each one. So there's lots of different types of forms here. This one looks like probably you would use for a spay surgery, because then they have the option here for retained baby teeth. If they need to extract baby teeth, that they can do it. So that I'm thinking that this is probably for like kind of a spay surgery situation. So this is just a standard consent form. This looks really similar to the type that I am most used to. It's just a generalized consent form. So you'd have the owner's name. Oh, who wrote meow and all these? The owner's name, the owner's address, name of the pet, whatever. You'd fill all this stuff in. It's basically saying, I own this pet. I'm allowed to make a decision for the pet. I hereby consent to the hospital to do whatever is written up here, right? And that the doctor deems necessary for the health, safety, or well-being of my pet. That's a little bit open-ended, but I specifically request the following procedures. So you'd write in here what you're going to do. Spay, IV fluids, blood work, nail trim, microchip, tattoo, everything you're doing, you write in here. I understand that during the performance of the procedure, unforeseen conditions may be revealed that necessitate an extension of the foregoing procedure operations or a different procedure operations than those set forth above. So in this case, they're consenting to the performance of such procedures as necessary. So basically, if there's an adverse event, that the vet is allowed to try to save your pet's life. I authorize the use of anesthetics and other medications. I have been advised about the nature of the procedure and the risks. The risks are so important. And this is important too. I realize that results cannot be guaranteed. Even in just like a routine spay or neuter surgery, it is possible for there to be complications and an animal could die. So it is important to make sure that we're not ever saying, oh, we guarantee it'll be fine, or I promise everything will be fine. And then I understand that I have to pay my bill, right? So this standard consent forms just consent forms in general are so important to have documented in the file, because then if the owner comes back at you and is like, I never said you could do that, I'm not paying this bill, you have a legal document, this consent form, that says that you authorize to do these procedures. Okay, so it is very important to have consent forms on file. Anytime you're doing anything where the animal's like staying in the hospital, it should be signed in with a consent form. Anytime the person is leaving. Okay? So those are some examples of consent forms. So back to our notes here. So confidentiality. We already kind of touched base on this in our code of ethics, right? But we are not allowed to give out information about staff or clients, even if it seems innocent. Oh, hi, I'm Sally's neighbor, and I saw that she had to rush her into the hospital today. What's going on? Is everything okay with Sally? Well, I can't really give you that information because you're not on the file, okay? I've had people where they're like friends and they bring their pets in all the time together, and I had one of them call and say they wanted to reschedule their appointments. I can't do anything for you for the other person because your name is not on the file. Okay, so we cannot give that information out. A breach in confidentiality could potentially be a violation of the law, right? And you could end up with legal action taken against you. So make sure that you are keeping things confidential in the hospital. Okay, so this looks a little bit different in yours because I edited it a little bit because I have this handwritten note about scope of practice on mine. Oh, and I see I missed a couple other things on mine. Sorry, I'm going to just touch back into consent forms, and we're going to skip scope of practice for now. So consent forms, one thing about going over them, we want to read them with the owner. So kind of how I did with you there, we're going to go over each line and say, you know, this says that this is your pet. This says, so we don't have to read it word for them, but we want to summarize what it says. And then we want to have the owner initial the specific risks or any declines or accepts. And then the owner has to have it signed and dated. Always ensure that they understand fully. So I go over the estimate. I always ask them, do you have any questions? Is there anything you need more information on before I get them to sign it? And then one thing we should talk about is consent in emergencies. So there are situations where an animal comes into the hospital, but the owner is not present. So if someone's driving a car and they hit a dog with their car and then they pick that dog up and rush them to the hospital, they are not the owner of that dog. So they cannot legally make that informed consent for the animal. In that case, we're going to stabilize the pet because that's like the decent and ethical thing to do is to stabilize the animal. But we can't do anything above and beyond that. So nothing that could be deemed as unnecessary. So we will do life-saving tasks, things like CPR. We'll intubate them. We'll get them on oxygen. We may or may not get IV fluids going, right? Because those are things that can stabilize the pet. But we're not going to run any blood work or take x-rays or start surgery. We're not going to do those things. We're just trying to stabilize the pet, life-saving tasks only. We need to keep trying to reach the owner if possible, right? So if we have like a tattoo or a microchip or a collar tag, we can use those to try to contact the owner. We need to document every attempt we make to reach them. So tried calling, left a message, 1 p.m. 1:05, tried calling again, left another message, right? And then once we have the animal stabilized, if we still haven't reached the owner, we can only give supportive care. So things like pain relief medication and like food. But we're not going to go ahead and start treating any illnesses or injuries until we've got that consent from the owner. Even if we help the animal and everything goes great, the owner can very easily say that they're not going to treat or that they're not going to pay because they didn't agree to the treatment. And they can technically sue you, right? Because they did not agree for you to do those things to their animals. So that covers our consent in emergencies. So let's pop back then to scope of practice. So I've said this a bunch of times already. Doctors are the only people in the vet clinic that can like prescribe medications and do make up treatment plans. They're the only ones that can make a diagnosis, that can say a prognosis, that can do surgery. So those are considered practicing veterinary medicine. So vet techs, VOAs, receptionists, kennel attendants, groomers, practice managers, unless the practice manager is a doctor, aren't allowed to do any of those things. So techs, here's my notes for scope of practice. So only a doctor can diagnose, prescribe a treatment plan. So that includes ordering tests, giving medications. They're the only people that can do surgery, and they're the only people that can give a prognosis. So vet techs, there are things that vet techs can do. We have a scope of practice list. So this is what we can do as written by the MVMA bylaws, okay? So we can utilize chemical restraint, which means giving sedation. We can administer and maintain anesthetic and analgesia, so pain relief medications. We can intubate an animal. We can euthanize animals. We can perform dental prophylaxis. We can administer the rabies vaccine. We can assist in surgery, and we can administer enemas. These things we can only do with direct supervision. That means that there is a licensed vet on the premises while these things are being performed. So I cannot give sedation to an animal if there is no vet in the clinic. I can't clean teeth while there's no vet in the clinic. I can't give a rabies vaccine if the doctor's out for lunch. Okay? The doctor has to be in the building when these things happen. I can also do these tasks, and I can do these under direct or indirect. Indirect supervision means that there is a vet that has told me to do these things, but that they might not necessarily be on the premises, but I can reach them if I need to. So they have to be available by phone. So I can collect, prepare, and analyze lab samples. So I can do blood samples, fecal samples, urine, milk samples, and like swabbing and skin scrapings. I can administer medications and vaccinations, excluding the rabies vaccine, because that's under direct supervision. I can do administer and monitor fluid therapy. I can do bandaging and splinting. I can take radiographs and ultrasounds. I can administer laser and ultrasonic therapy. I can perform contrast procedures on the gastrointestinal tract and lower urinary tract. So that means like barium x-rays. And I can express anal sacs internally. I can utilize an EKG machine. I can tattoo and microchip animals. I can clean and irrigate ear canals. I can administer local anesthetic for the purpose of dehorning food animals. I can dehorn food animals, and I can remove skin sutures or staples. So anything else that isn't on this list, if I were to do, is technically practicing vet medicine, right? So I can't just say, oh, well, I know the doctor would send home this medication, so I'll just go ahead and do it. That would be practicing vet medicine. I can't be like, well, I'll just extract this tooth real quick while I'm doing a dental cleaning, because that's dental surgery, and surgery is for the veterinarian. So there's some things that we just plain can't do. It's outside of our scope of practice. So what about vet office assistants? So VOAs can't do anything from either list. You can't prescribe, you can't diagnose, prognose, or do surgery, and you can't do any of the things that I just listed here, okay? So none of those things are allowed by a VOA. So you guys aren't allowed to draw blood or collect urine. Well, I mean, I don't think it's unreasonable to allow you guys to collect urine via free catch, where you just put a bowl under a dog that's peeing. But like, you guys wouldn't be able to like pass a catheter to collect urine. You know, tattoos or microchips, those things you guys aren't supposed to do, okay? So that would be practicing outside of your scope of practice, and to do so means that you're practicing veterinary medicine without a license. That is illegal. You could have legal punishments, fines, or jail time, and as well, it is potential that you could be sued. So I pasted in this little article here that was sent out about vet techs and liability insurance. We have to have liability insurance. If something happens in the vet clinic and it is our fault, we are potential to be sued by the clinic. Or sorry, not the clinic, the client. Obviously, we don't want to be sued because that is going to be very expensive, and it can honestly really ruin your life. And if you are practicing veterinary medicine without a license, you could be sued as well. So please be aware of that. If you are ever asked to do something outside of your scope of practice, politely decline and say, that's outside of my scope of practice. I don't feel comfortable doing that task. Because it's against the law for you to do that task, and you could potentially be getting like jail time or fines, and you could be sued. So I really don't think you guys want that. So please be aware of those scopes of practice. Okay. So I also have added in here, do not perform any procedures that you haven't been trained for or that you feel is unsafe for yourself or the animal. So I do this often, honestly. I'm not the hugest fan of interacting with really angry dogs. I love handling fractious cats. I think I'm really good at it. But dogs, I'm just not very great at it, and I will usually try to defer if I feel like it's unsafe to me or to the animal for me to be handling it. So if it gets beyond my capabilities, I'm going to get someone else that's better at that job than me to do that job. So if someone asks you to do something and you're fairly new there still and you're not really sure how to, don't just try to fake it till you make it. Let them know that you need further training in that task. You'd be happy to complete it if they offer you the training right now. Otherwise, you know, it might be better to have someone else do it and train you at a later date. So make sure that you are not doing something that you could potentially hurt yourself or the animal. And if there is an emergency in the clinic, if someone rushes in that dog that was hit by a car, but there's no vet on site, we cannot do anything. We have to send that client to the next nearest vet clinic. We can't do anything. So without a doctor there, I am not able to start doing those life-saving things, okay? So we need to send them away. I have had times where I know that the vet is on their way, and I will call them and say, I had an owner just walk in with an emergency. Can I start, administering oxygen and get an IV catheter going? And they'll usually say yes. But if I can't reach the doctor, I can't do anything. Okay, so this is another legal thing we need to know about, and it's called the Vcpr. So the Vcpr is the Veterinarian client-patient relationship. It's the professional relationship between the veterinarian, the client, and the patient. It has to be established in order for the doctor to do things like prescribe medications, and it has to be maintained, which means that the vet needs to see the patient at least one time per year. So there's 4 criteria that must be met for a Vcpr. The first one is that the vet has assumed responsibility for making clinical judgments regarding the patient. So basically they're saying, yes, I'll be your vet. Oh, that's funny. These are a little bit of a different lineup than in our other course. We talk about the Vcpr again in dispensing. And in dispensing, number 2 is that the client agrees to take the recommendations of the vet. So both client and vet have to be on board. And then the vet has sufficient knowledge of the patient. The vet must have seen the patient, and typically that's within a year, at least. So if your pet has been seen within a year and you want to get like some heartworm medication, the doctor probably won't make you have an exam to get that. If you were seen, 9 months ago because the dog had vaccines done, and now you're calling because the dog is vomiting and you want the doctor to prescribe medications for vomiting, the doctor's not going to be able to do that. The doctor needs to examine the pet now to see what's going on with the animal to be able to make the judgment call of whether or not they should have medications. So the vet has to have examined the patient. And then the vet needs to maintain records. So that's why we have those medical records and files that we'll be talking about soon. And the vet has to be available for follow-up or have coverage arranged. So if they're going on vacation or something, they need to have like a vet take over for them. Or if there's other vets in the facility that could follow up with the patient if needed. So if any owner wants a prescription product, dispensing and prescribing it has to be done with a Vcpr. So the doctor has to have met these criteria to be able to write a prescription. This is something you will be discussing often with owners. So many times they're like, oh yeah, my dog had ear infection like 3 years ago. Can you refill the medication for me? No, we haven't seen your dog in 3 years now. We cannot refill that prescription because we do not have this relationship anymore. We haven't seen you within a year. So we're going to need to make an appointment with the doctor, okay? Okay, and then how do we maintain professionalism? So we've talked about ethics, we've talked about just legal issues. Our last topic here is professionalism. So there are 3 major aspects. A professional appearance. What does that look like in the vet clinic? It looks like wearing your uniform. So usually that's going to mean scrubs. Your uniform should be clean. It shouldn't be wrinkled. It shouldn't have hair all over it. So if you were handling an animal and then you were all hairy, you go ahead and you use a lint brush to get all that hair off. If you're peed on or you have a poop smear, you go ahead and get those scrubs washed and you wear a different set while they're in the wash. You look neat and clean. You have limited jewelry. That's also a safety issue in the vet clinic. I would recommend not having really like long nails too. That's a safety issue. And you know, like neat tied back hair in the vet clinic is important so that you're not, you know, your hair's not getting caught in the animals while they're struggling. So you want to look neat and presentable and clean. That's very important and sometimes difficult to manage in the vet clinic. You also want to have professional conduct. So that means that the way you act is in a professional way. So we want to use more formal greetings as opposed to, you know, sup, how's it going, right? We want to say, oh, hello, welcome to the vet clinic, how are you today? Like that kind of thing. We want to have a professional conduct. And we want to have professional communication as well. So we don't want to be swearing or using like slang terms. We want to be professional the way we talk to our clients. So I have a couple examples or tips here for you. So we want to watch what we say and do. If you're not comfortable saying it like in front of your grandma, maybe you shouldn't say it in front of the client either, okay? Clients don't need to hear about your weekend plans or your sex life or whatever sweet strains of cannabis you found. They don't need to hear about that. Don't talk about those things in front of them. We want to not make faces during phone calls. It sounds in your voice how irritated you are with the client. I know a VOA specifically that does this all the time. She'll be like rolling her eyes constantly and making like meh, meh, meh kind of faces while the people are talking. And then when she responds to them, she just sounds miserable. So like keep the smile on your face. You'll sound more professional. And then also you don't risk people in the waiting room seeing you making snarky faces on the phone. Guaranteed, if you're in the waiting room and you see someone make a snarky face, you're going to assume that they make snarky faces while they're talking to you. And I'm not going to want to go back to a clinic that treats people that way. Be careful with the conversations with other staff members. So you want to not be speaking loudly about, you know, I don't know, how much diarrhea you had last night or whatever. Again, clients don't need to hear that. So be careful with those conversations. Whether you're in front of clients or not. So vet clinics tend to be fairly small and sound travels. So be aware of that when you are talking in other areas of the clinic. You want to be careful with conversations in front of clients. Don't talk about other clients in front of clients. You know, maintain that confidentiality with them. Don't whisper in front of clients. Guaranteed if someone's whispering in front of me, I assume it's about me. And that's just, I think, human nature. So be careful with that. Whispering isn't really appropriate, honestly, kind of ever, right? So be careful with the whisper. You don't want to look like you're talking about somebody. And then lastly, make sure your humor is tasteful. So a cute little joke about the weather, great. A joke about religion or gender or politics or sexual orientations or anything like that is not going to be appropriate. So like just keep if you're like the kind of person that likes to make jokes and you're funny, awesome, that's great. I love funny people. Let's hang out. But if you are making jokes at someone's expense, or it's like a divisive hot topic, just don't make the joke. Leave that for whoever else thinks that's funny, but that's not appropriate for in the clinic, and especially not in front of clients. Okay, so we've talked about ethics, we've talked about some of the laws we need to abide by, and we've talked about how to maintain professionalism. So one last thing I just wanted to say about ethics to kind of help you hopefully with that discussion. One thing I like to do when I'm making, when I'm helping myself, to make a ethical decision, is I kind of like to weigh the pros and cons, right? And see like what's at stake here. So if I'm making a decision what am I really basing it on? What is really my motivation here? So is it like what's best for the animal? Is it what's best for the client? Is it what's best for my practice? Is it what's best for me? What's the situation? When we're kind of looking at what things are right or wrong, we want to look at that code of ethics and see if we are breaking any of those, okay? So one I really point out to you is safeguarding the public and the profession against individuals deficient in personal ethics or competencies. So in this scenario, there's a potential that a veterinarian is stealing drugs. If someone is using those, if the person's stealing them and using them, they could really potentially be making bad calls in the clinic and end up harming an animal. Same with like, if you know that someone is showing up to work and like they're using some kind of substance before getting there and they're making mistakes, or they're you know, they have a lot of potential to really hurt something. So even if that's your friend, I think it is your obligation to report that kind of situation, right? But anyways, I don't want to really get into this scenario because I want you guys to really, you know, use your own thoughts on that. But one thing that I do ask myself is like, is the situation in question, is it against the law, right? That isn't always, though, the best ethical question to ask, because sometimes the law doesn't really reflect what's right or what's wrong. So think of like, you know, slavery or women not being allowed to vote. Those things are like really shitty things. Those are wrong things. And that was the law, right? So that's, sometimes the law isn't a great reflection of ethics. And then I kind of asked myself the question of like, what would the rest of the community think, right? So what would the rest of the vet community think about this situation? So if you are kind of in line with the majority, then, you know, you're kind of maybe more on the right side there. And you should ask yourself, like, how do I feel about this? Like, sometimes you just really need to tap into that gut feeling, right? If you feel like something is wrong, it probably is wrong. And then lastly, I kind of just think like, would I be proud to tell like my parents or like a trusted adult or whoever, if a trusted person in your life that you value their opinion about you, would you be proud to tell them about your actions here? So I think those are good things to consider when you are faced with an ethical dilemma. Okay, so we talked about a lot of stuff there. I hope I'm not, you know, totally hammering you with information here. Certainly the consent form thing is really important. You're definitely going to be going over consent forms often in clinic. I think the code of ethics is really important too. It is important to know what exactly you're working with, right? Like what you should be doing to be doing the best thing at your job. And then we do want to be aware of those examples of malpractice, that we're not doing those, right? That's super important. Okay, so that's everything I have to say for now for this video lecture. So thank you so much for listening. There is information more about ethics and legal issues in your textbook. I will just say one thing though about the textbook. It's American. Some of that legal stuff might not necessarily apply in Canada. So don't focus too heavily on that stuff. Like focus on the notes that I gave you in terms of studying for your test. I think there might be a lot of stuff about like tort law or something like that. We're not concerned about that in this course. Okay, so thank you so much for listening to this video lecture. And if you do have any questions, make sure you do please ask them in the virtual classroom, in the chat, or send me an email. Okay, thank you. Bye-bye.